Hi, I'm Michelle Ginsberg. I'm a thoracic radiologist, and I'm Director of Cardiothoracic Imaging and Vice Chair of Education at Memorial Sloan Kettering Cancer Center in New York City. How do we decide when to image with a PET CT or a CT, and which is the right test for lung cancer imaging? Well, both of these are vital and really complementary to each other. And they're both used in the evaluation of lung cancer patients. CT is generally what most patients present with initially because that's how their tumor was initially detected. And we would get additional PET CT imaging in individuals that are already diagnosed with lung cancer because it's part of the NCCN guidelines, and it's very important in identifying several things in addition to what the CT would. It will be actually much more useful for M staging, which means that we'll find metastases if there are any in other organs. It's very useful in identifying lymph node metastases in the mediastinum, hilum, and also bone metastases. But going back to the CT scan, the CT scan is especially useful in the initial staging. And we use that to categorize the tumor on the T stage. So it's helpful with the size of the tumor, the invasiveness of the tumor, and the characterization of that. And also, CT will identify lymph nodes. Now, it's not very specific for these things. That's why a PET CT is complementary, because a PET CT is very useful, it has a very good negative predictive value for lymph nodes. So if a PET CT doesn't show any lymph nodes that are hypermetabolic, it's useful in that sense. But if it's positive, because it has a very high sensitivity, over 90%, unfortunately, it's not as specific. So the specificity is only at about 85%. So if we find lymph nodes that are avid, that may lead the surgeon to do a lymph node dissection in those cases to characterize those lymph nodes. Now, the PET CT can also be useful in the initial staging as far as identifying the lesion. Sometimes you may have a tumor that's right next to collapsed lung, and it's hard to delineate what's a tumor and what's collapsed lung. So it may help with the biopsy. We do PET CT guided biopsies where the interventional radiologist will target the lesion that's avid. So you're not targeting the adjacent inflammatory changes or collapsed lung. Similarly, it could also help the radiation oncologist. If they're going to treat with radiation, they want to target the smallest area. So if you don't know what's collapsed lung and what's tumor, PET CT could be helpful because you'll see it focally avid where the tumor is. So that way they don't have to include collapsed lung in their treatment field. Another way that PET CT is useful for the radiation oncologist is when they use SBRT, which is targeted treatment of early stage, generally, tumors in medically unresectable patients. And those scans are very difficult to interpret on CT. So when those patients are followed up with subsequent CT scans, it's hard to tell what the treatment effect is from the radiation versus the tumor and tumor recurrence. Sometimes tumor recurrence can look like the radiation changes. And in those cases, a PET CT is extremely valuable. And if it's focally avid, where we suspect something on CT, then that could lead to certainly a different management and requirement probably of a biopsy of that area. So it's useful in the initial staging and also in the follow-up of these patients throughout their treatment and follow-up.